Good morning, good morning, good morning. How are you? And thank you for listening to the Great Lakes Health Radio program here on Power 96.5 FM, WUFO AM 1080 AM. My name is Francesca Messiah, Manager, Workforce Development at Kaleida Health, and I am so happy you are joining us again on our two-part radio program. The first part of the show today, the first half hour, we will be speaking with Dr. Gillespie Sosa, and we'll be talking about fibroids and women's health issues. And the second part of the show today, we'll be talking about healthy eating on a budget. And we're covering all kinds of budgets. And that's the second part of the program that begins at 7:30. So before I introduce our guests, let me just give a little overview about Kaleida Health, because it's always a question in the community and a question in general. Kaleida Health, over 175 years old. I should say Buffalo General Medical Center, which is part of Kaleida Health, is at least 175 years old. Other buildings that are part of Kaleida Health are the Gates Vascular Institute, DeGraff Medical Park. Also at DeGraff, we have a long-term care center. Other hospitals include Millard Fillmore Suburban, Oshai Children's Hospital, and on the other side of Oshai Children's Hospital, within the same building, is Conventus. That's where several of the medical offices are. Also, we have Visiting Nursing Association of Western New York. That's where we give long-term care 24 hours a day, 7 days a week. There's High Point on Michigan, also long-term care and rehabilitation. And we have clinics and specialty care clinics for adults, for children, physical therapy, cardiac throughout Western New York and the Southern Tier. And in the Southern Tier, we do have two hospitals, one in Olean, New York, and another one in Bradford, Pennsylvania. That gives you a little bit about Kaleida. And don't forget, we have speakers available. If you're interested in a speaker coming to your event or a health or wellness or someone to talk about careers, we have all of that. We have you covered at Kaleida Health. Well, today's topic is a topic that someone probably brought up to me over a year ago. It has been at the top of my mind to find out who can discuss this. And I met this person. I met this physician, Dr. Gillespie Sosa. Good morning, Dr. Sosa. How are you?
Hi, Francesca. Hi. My
Hi,
first name is actually pronounced Jaleese.
Jaleese,
Yes, a
Jaleesa.
little easier than it looks. Just Jaleese.
Okay.
hmm
Thank you. And Dr. Sosa is obstetrician gynecologist at the Oshai Children's Hospital. And Dr. Sosa, how long have you been with Kaleida?
So technically, I've been with Kaleida just for a short period of time, but I actually trained at Kaleida hospitals since 2013. And at my previous job, my entire career, I should essentially say, I have done deliveries and surgeries at Kaleida facilities, both at Oshai Children's Hospital and at Millard Fillmore Suburban, despite my office being at another practice. But for the past, 13 years, I've been at Kaleida hospitals.
Oh, well, wonderful. Well, so I can't even say welcome because you've been here. Welcome. I can say welcome to the Great Lakes Health Radio program because it's your first time, but not your last time. So today's topic, we're talking about uterine fibroids and women's health issues, part one. Part one, because we know women's health issues and fibroids. Fibroids is a topic someone asked me about a long time ago. And I'm calling this part one because I know this conversation will continue. So fibroids, Dr. Sosa, what are fibroids? Where do they come from? And do men have fibroids?
I'm really glad we're discussing this topic because fibroids are actually pretty prevalent. About 70% of women will encounter fibroids by the time they turn 50. And in the African American population, about 80% of women will encounter fibroids. Fibroids are benign, thankfully. They're benign tumors of the uterus, and they are formed by the muscle cells that make up the uterus. So, a muscle is a large uterus. That's what allows it to stretch and expand when someone is pregnant. And those individual smooth muscle cells that make up that uterine wall, they sort of go rogue and turn into these growths that don't follow the rules and instead form these little tumors that look could be as tiny as a little pea to as large as a basketball or even larger over time. Um, where they come from, admittedly, we have not done sufficient research on fibroids. You might know from the federal level, or previous vice president was trying to do work to expand research on fibroids because it affects so many women. And so the little data that we do have, we know that fibroids may come from a genetic mutation, the MED12 gene, where someone may be born with that mutation, or over time that gene changes because of other factors that contribute to that change. And when that change occurs, the fibroid now develops significantly more receptors for estrogen and progesterone, which are the hormones that ovaries produce. And then they, again, just don't follow the usual rules. So they overgrow, they grow very quickly, and they grow very large and become these tumors that feel more like the consistency of a baseball. So usually the uterus may feel more like a marshmallow. And then when you have fibroids, these individual fibroids feel like a baseball. Do they affect men? Let's put it this way. Fibroids affect anyone that has a uterus. So if you have a uterus, you have the potential to have fibroids.
Okay. Something you just mentioned, and number one, I was not aware that there was research that was being done in the area of fibroids, and that's glad to hear that that was. It sounds like it may have stopped, right?
Unfortunately, with all the other changes coming from a federal level, where research is being halted, but there are congresswomen who are really pushing to get that to go again. So there's hope for the future.
Oh, good. Oh, I'm glad to hear that. But have they found, do they know why African American 80%
Hmm.
are, why 80% of African American women, has that been any, are you aware of any reason that's been able to explain why?
Yeah, it's unfortunately a similar idea as several other conditions. For example, why American women may be at higher risk for maternal mortality and other diseases that are prevalent in the US. The reason is multifold. So one, a person may be born with that genetic mutation. Two, there are environmental and lifestyle conditions that could affect it. So, in several of our products that we use for self-care, so whether it's our perfumes or makeup, sometimes even like our face washes, skincare products, things found in relaxers can contain um, what we call endocrine disruptors. And so those endocrine disruptors may be found in less, um, let's see, less regulated uh, supplies, and that may be used more so in the African American community. And as a result, people of African American heritage may be at risk. Um, Other things like the genetic changes. So genes age, and genes can, their aging can quicken when there's more stress involved. And they have found that historically, because of racism, because of systemic inequities that affect African Americans, gene aging, something that's been termed weathering, occurs more commonly in those of African American heritage. And as a result of that weathering, there's a greater chance of those mutations, like that MED12 gene mutating, and as a result, causing fibroids and several other conditions that unfortunately may make African American women more at risk for these conditions. So a combination of existing in a community, in a society where inequities are prevalent, being exposed to environmental factors, whether it's because of location of where you live, even things like redlining can affect, where African Americans are found in a community, and as a result, what chemicals they're exposed to, therefore affecting these genes, therefore leading to fibroids, to things like lifestyle, whether someone eats more red meat, ingests more alcohol, those things can also factor into what makes African Americans more at risk.
That is amazing. And listeners, I will repeat this show in the future. So don't worry if you missed everything. Plus, the program will also be on our website. That what you said is such a mouthful and so much to grasp. I know that the program within a few weeks after it's aired will live on the Kaleida website. But that is just fascinating. And the Med 12 gene, that I
Yeah.
can tell right now, that's just a whole nother conversation in itself. Thank you. At what age do fibroids develop?
So we know that fibroids affect a person in reproductive age. So from the moment one starts to have a period to when those periods end, so at menopause. We've not we've not found fibroids in, a 9-year-old or a 12-year-old before they have a period. And we know that fibroids tend to grow more because of the effect of estrogen and progesterone, which start to be produced at what we call menarche, or when the period starts. And then once menopause hits, so once the ovaries stop making that estrogen and progesterone, fibroids essentially become ineffective. And for many women, they even shrink. So to make a long story short, the reproductive age from the start of a period to menopause.
Okay, and that can be a long time.
That could be a long time. I would say most folks, we encounter the fact that they have fibroids probably in their late 20s, early 30s. Most times in the 40s is where we tend to see them being the most problematic, because by then, if they've not been detected before, they're large enough to cause symptoms. And then as we age, as the ovaries slow down that production of the estrogen and progesterone hormones, the fibroids start to decrease in size and become less problematic. Sometimes I think this is important to know, as if they're African American listeners, you might be told by a physician, oh, you're close to menopause, your fibroids should not be an issue anymore. That may not actually be true for African American women, because that regression does not happen as rapidly as other races. And so you should still pay attention until that full complete year of no periods.
Yeah, and I have to say that having been first diagnosed with fibroids in my 20s, I fainted when they told me because I didn't know what they were.
Mm.
But later on it was anyway. How many fibroids can fill a uterus? Because you said sometimes they can be as small as a ping pong ball or as large as a football, did you say?
Yeah, basketball, even larger. As many fibroids as the uterus could handle. I have been in cases where we have something we sort of determine it as miliary fibroids. So they're almost multiple pea-sized lesions, tumors, these fibroid tumors throughout the whole uterus. You can have hundreds of them that are that small, or more typically what we see maybe a few where you have a dominant one that may be the one that outgrows the others. So it's much larger, and then you have several smaller ones. So there's no limit to the number of fibroids one could have in one uterus.
How about warning signs? And this is your interview, not my interview. So I won't even talk about my warning signs. It was a eye opener.
Yeah.
But what are some of the warning signs from the medical side that you see?
So the typical signs are would be heavy bleeding. Most times you have a regular period, but it tends to be way heavier than one would consider normal. What often happens though is many women sort of just consider themselves as, oh, I'm the kind of person who just have heavy periods. And so they may not mention it to their doctor, or unfortunately, their doctor may not choose to investigate it. Heavy periods are not normal. A normal period, if you're using 5 or more pads a day, something's wrong. If you have to double up on a pad and tampon, something's wrong. If you're scared to leave your house because you might soil your clothing, something's wrong. If you have to lay down a towel at night in order not to soil your sheets, something's wrong. So heavy periods are the most common thing. You should have an ultrasound to check that out. Other things are affected by the size and location of the fibroid. So larger fibroids, you may actually feel them yourself. You may feel a firm area on your abdomen, on your belly. You may not be able to lay on your stomach without feeling some discomfort. So that might be a large fibroid causing that. Less typical signs, which might sometimes be falsely attributed to other conditions, maybe constipation, because the fibroid is pressing on your intestines. You may have urinary frequency because the fibroid is pressing on your bladder, so you tend to go to the bathroom more often. I actually had one patient who, for a long time, was treated for reflux, and she was on medication and wasn't getting better. They were increasing the medication. And then she came to see me and she mentioned it. And this was my first time seeing her. And I did an exam, and her uterus extended all the way up to her rib cage. So imagine from your pelvis all the way up to your rib cage, that's your entire uterus. She was having heartburn because that uterus was pressing on her stomach. So that's not a common sign, but it could also be one of those atypical signs that could be a sign of fibroids. So you never know. So it's really important to see a gynecologist regularly and have that pelvic exam so we could assess the size of that uterus because it doesn't always present as bleeding or pelvic pain.
And I have to say, what was mine? I was at a conference. I remember it was
Mhm.
New Orleans, and it felt like someone had just kicked the crap out of my side,
Oh man.
and I couldn't figure out what was wrong. So that pain, that extreme pain, I'll never forget. It was a conference. It was hot, and all of a sudden, I'm walking down the street, and whatever this kicking was, whatever it hit, just made me double. And then everybody kept telling me, because I was thinner then, kept telling me how fat I was getting real fat in my stomach. And I was
Hmm.
doing up to 500 sit-ups a day. And everyone was like, you're putting on some weight. No, those were my fibroids that were growing in my body.
My goodness. Yeah. That could happen. Yeah. So, again, sometimes the bleeding may not occur and you just have these other symptoms, the pelvic pain. Yes, that you're noticing that you're just gaining your abdomen is more and more looking like a pregnant abdomen. You should
Mhm.
definitely have your gynecologist check that out.
Right. And what are the treat? Oh, what are the treatments for fibroids?
Thankfully, we're in 2025 and we have several options. I like to tell my patients, this is not your grandma's fibroids, thankfully. So in the past, everybody's solution was a hysterectomy, and that is not the case. And that's something I'm quite passionate about as a gynecologic surgeon and one who tries to offer alternatives to hysterectomy. Uh, Hysterectomy is often the last resort and should not be the first thing you're suggested. The range of treatments go from medication, where it doesn't necessarily make the fibroid go away, but it may treat somebody's symptoms. You may have, there's some medications that suppress the ovaries from producing too much estrogen, and as a result, you may have no periods or shorter periods. And what that does is treat the symptoms, perhaps primarily of bleeding, and it may treat the symptoms of bulk, where the uterus gets smaller, somewhat smaller. so that you don't feel that discomfort or pelvic pressure from the fibroids. The issue with those is that they're only could be used for a short period of time, for a maximum of 2 years. And once you're no longer taking them, your ovaries start to work again. And so the hormones produced by the ovaries again can cause the fibroids to grow and those symptoms return. So those are usually effective in someone who may be close to menopause and has symptoms now and may just want something to carry them through menopause. They're an ideal candidate for that. Or for someone who just isn't ready for surgical management and or they may, be planning pregnancy in the future and they just want symptom relief for the immediate time, then that's a good option. The option that I most commonly do is myomectomy, which is the medical term for removal of fibroid. And I do these robotically where we have a minimally invasive procedure where you avoid the C-section scar and you have smaller incisions, and we go in and remove the fibroids through these small incisions. That's often helpful again for bulk symptoms. So usually when the fibroids are large, surgery is needed. So we are able to remove those large fibroids, causing some relief that, where your belly looks larger, that goes down, where you have pelvic pressure and pain, the constipation, the urinary frequency, it relieves those symptoms. Another procedure which hopefully we'd start offering again at Kaleida is called an radio frequency ablation of fibroids. This is another minimally invasive procedure done by gynecologists where we put a probe directly into the fibroid that we're looking at using ultrasound at the same time, and we burn the fibroid from the inside out. And this essentially what we call denatures or kills the fibroid, so it's no longer active. It shrinks to about half its size in a few months, and the bleeding is relieved. So that's called a radiofrequency ablation. The other procedure that a gynecologist may perform is the hysterectomy, like we mentioned. Again, I kind of think of this as a last resort. If nothing else works, if the patient is absolutely sure they're done child rearing and they are okay with removing the uterus, or they may have other conditions where removing the uterus is necessary. And that one also I and several other colleagues do robotically or minimally invasively, avoiding large scars up and down or C-section type scar. Outside of that, this is a mouthful. Radiologists, what we call interventional radiologists, can do a procedure which is actually a great procedure for the right patient. This is called uterine artery embolization or uterine fibroid embolization, sometimes shortened to UFE or UAE. And this is an in and out same day procedure where they run a catheter through your wrist from your vessel, your blood vessels in your wrist, all the way down to the blood vessels that supply the fibroids. They release these tiny microscopic little balls, silicone balls, that then plug and block the blood supply to the fibroid. And by blocking that blood supply, the fibroid has nothing to feed off of anymore. And the fibroid shrinks, it gets smaller, and your symptoms improve. For the right patient, meaning for this procedure, the UFE, you need to know that you definitely don't want to have kids in the future because it's not recommended in patients who might choose to get pregnant. And the size of the fibroid matters. The location of the fibroid matters. If the fibroid is in the cavity, we cannot do that procedure. If the fibroid is too large, we cannot do that procedure. But for the right patient, it's also a good option because you're back to work in a couple of days. The procedures I do, you may need downtime from work. So the myomectomy, hysterectomy, you may need to be out of work minimum 2 weeks, sometimes 4 to 6 weeks, depending on how many fibroids remove and how extensive the surgery is.
Thank you. And you know what? We are almost out of time. And I just want to make a comment on something you said about heavy bleeding going through the pads. If your grandmother or your great grandmother, your sister, if they went through all of this, they may have had fibroids and had never been diagnosed. If you're listening to this show and you're going through that, the heavy bleeding, using all the pads, all those things, the pain, how would they reach you, Dr. Sosa? Are you taking new patients?
Absolutely. Managing women with fibroids is a personal passion of mine. Again, because it has been understudied and because of the inequities regarding how we manage it. So you can catch me at either of my two clinics, Niagara Street OBGYN, 564 Niagara Street, and you can call me there at 716-768-7700. And at Kensington OBGYN, 462 Grider Street, 716-898-5000.
Thank you. And we have about, I think, about 2 minutes now. My favorite question, because it happened to me, can fibroids return?
Uh, you, not that they can return per se, but that the uterus has that potential to make them. So yes, you may have a procedure where the fibroid's treated or it's removed, but remember, if you have that MED12 gene, if you're still exposed to those environmental factors, that uterus still has potential to make new fibroids. So it is important to do surveillance each year where we repeat ultrasounds to assess whether new ones grow. And maybe in part two, we could talk about some of the things you could take to help prevent growth of new fibroids.
Yes, and you know what? And let's do that because I'm one who had they came back. Matter of fact, I remember having so many the different ultrasounds. I learned how to read the ultrasound machine. I mean, I would laugh
Yeah.
at the technician because I could see I was but definitely part two. And what do you recommend? Tell me that so I can our guests will know we will have a part two. And what will we call the show?
Vitamin D deficiency is highly linked to fibroids, so you may need to be on a daily vitamin D supplement. And there's this other component of green tea. I'm not encouraging everybody to go out and drink green tea, but it's
Yeah.
called EGCG. The name is pretty long. It's epicalogallate catechin that has been studied and shows to decrease the growth of present fibroids and slow the
Yeah.
growth of new ones.
Okay, well, you know what? On our part two, we will talk about that, and we'll talk about fibroids possibly returning and what to do to prevent fibroids. So, thank you so much, Dr. Sosa, for being our guest this morning on the Great Lakes Health Radio program. And listeners, don't go anywhere. Part two of our show, we'll be talking about healthy eating on a budget, which really healthy eating also ties in with fibroids, and we can even talk a little bit about good healthy foods to prevent fibroids. And once you have fibroids, on the part two of that show, but our part two is healthy eating on a budget with Kelly Cardamone coming up in a minute. Thank you, Dr. Sosa. Thank you so much.
Thank you for having me.
Oh, you're welcome. And now on to part two. Thank you for listening to the first part of our program. And I know you will be very excited to learn about the information that Kelly Cardamone, who is our guest this morning on the Great Lakes Health Radio program here on 96.5 FM WUFO AM 1080. And Kelly is not a stranger to our show. Kelly is a clinical nutrition and also diabetes program manager for General Physician. And General Physician is a part of Kaleida Health. And General Physician has, my gosh, they have specialty care, primary care, gastrological care, care for all ages. But today, our topic, we'll be talking about healthy eating on a budget. We're all on a budget. Some of us stick better to a budget than others. But not only are we talking about healthy eating on a budget, Kelly is also going to provide us with recipes. Good morning, Kelly. How are you?
Good morning, Fran. I am doing well. And yourself?
Great. And right before we started the program, Kelly is just, oh, should I say what you're steps away from?
Yo, go right ahead. Sure.
She is steps away from receiving her PhD. And what is your PhD? Is it going to be in clinical nutrition?
Yes, it'll be a doctorate in clinical nutrition. Yep.
Oh, well, I'm telling you, Kelly, I call Kelly the rock star of nutrition because she also does speaking engagements in between her clinical visits with patients on nutrition. But we're going to get started right now, which is a segue. Can you briefly share your background as a clinical nutritionist?
Sure. So I've been a registered dietitian for about 20 years, almost 20 years, diabetes educator for about 15 of those. Also board certified in integrative and functional nutrition. We shared finishing my doctorate, I also have a degree in exercise science, which is nice because I try to combine, exercise as well as with nutrition. And as you shared, I built and run the diabetes and clinical nutrition program at General Physician. So I see patients and manage the program as well because I really am passionate about nutrition. And also, I am adjunct faculty at D'Youville University.
Oh, that's wonderful. And listeners, it's not part of our show, but if anyone has any questions about the GI, why their food isn't digesting, if you keep getting sick from eating certain foods, those are the kinds of questions that Kelly is able to answer in her office at General Physician. So I just had to say that because GI is another hot topic. So for today, healthy eating, what exactly does healthy eating mean? And is healthy eating and eating a balanced meal the same thing? And why is all this important?
So great question, because I think a lot of times it's a loose term saying, I need to eat healthy, right? And that really does mean something different for each individual, depending on what they're trying to maybe manage or prevent. But believe it or not, the term healthy eating is a definition that really continually evolves and is changing the more we learn about how what we eat impacts health and disease. So healthy eating is basically this umbrella term, and it really includes all of our food choices. But the goal of it is it's essential for good health, right? So it includes eating a variety of foods that contain necessary vitamins, minerals, macronutrients, which are like carbs, proteins, and fats. Now, a balanced meal is part of healthy eating. So again, that healthy eating is kind of that all-encompassing umbrella term. And then we've got a balanced meal. And a balanced meal, if you think about it, is it combines those healthy foods in a good way to provide the nutrients that you need. And for some people, a balanced meal, like if you have diabetes or pre-diabetes, which is a high proportion of the population, their balanced meal might appear slightly different than somebody else's. Again, if you're trying to control a chronic illness or disease, typically I tell everybody a balanced meal is half a plate of vegetables, a quarter of it should be carbohydrates. And that would be like rice or pasta, even fruits, starchy vegetables, potatoes, and peas and corn. Keep that to about the size of your fist. And then a quarter of your plate should be protein, which is usually about a deck of cards or palm of your hand. And that would be lean proteins. That can also be beans, by the way, but like fish or chicken, or things like that or eggs that, provide those necessary nutrients.
Mm-hmm. Yeah, thank you. And I know that, and that balanced meal, I just hear my mother's voice, eat a balanced meal. So that's where that kind of question came in. Now, when feeding young children, how does their nutrition differ from adults?
The interesting part is often we'll say, or people do think like, well, they're just, little adults. And they truly are not, right? Developmentally on all levels, they really are not little adults, right? They're growing and developing into adults. And their nutrition, so that concept applies where healthy eating is essential, right, for overall good health. And a balanced meal, should be balanced in a sense where it's going to give you things from different food groups to supply what you need in a healthy way. But the focus for children, so for adults, as I mentioned, hey, maybe we're trying to control or prevent, high blood pressure, high cholesterol, lose weight. But for children, it's really important that we give them the nutrients that they need to support growth and development at different stages in their life. And you have to remember that, kids are rapidly growing. So a lot of times there are certain periods of their life they may need a little extra protein, extra fat for brain development, maybe extra calcium or vitamin D or iron. And when I say extra, I don't mean for children to, necessarily give them supplements like vitamins and things, extras, unless they need them. But you want to try to do food first. So you want to try to make sure they have a balanced meal with the protein and the carbohydrates and the vegetables to really provide what they need for growth. On a side note, I often hear a lot of times people will say, oh, well, they can just eat, the ice cream and the chips and stuff because they just burn it off and they're growing. And that's really not how you want to approach a child's, diet and overall health. You want to teach them now to eat healthy because those are the food habits that they carry throughout their life. And a child who's growing, or a teen even, or an adult, doesn't need the heavy saturated fat like the fast foods or those sugars, right? The added sugars that we find in candy and cookies and beverages and things like that.
True. No, thank you. And thank you for explaining that. If someone has access to a food pantry, and I know that in a food pantry, they're very conscious of the food that goes into the bag, and they have limited access. So they have access to the food pantry, but limited access to the grocery store. What foods with a long shelf life are healthier? So when they look in that bag from the food pantry, or they're at any either large department store. I'm thinking of like of our major mega stores like your Aldi's and
Grocery
places,
stores, yeah.
grocery store. So when they're looking for food for a long shelf life, again, we're on a budget. What are the foods that they should focus on?
So the things that you want to focus on, again, if you're, like you said, if you're at a food pantry or if you are going to the grocery store, or quite honestly, depending on what you have access to, sometimes it's going to be a convenience store, right? Or
Exactly.
or a larger store that kind of carries groceries as well, as sells like clothes and other things. So there's a lot of options. But the things that are going to be healthy, that are going to be more nutritious, meaning they're not just going to provide calories. They'll give you some vitamins, minerals, and good fats and all that, and fiber. Things like peanut butter are fantastic. If there's any nuts and seeds that you can purchase, those actually are a great snack, also good shelf stable. Some of my favorite are oats. Oats, you can use actually things, you can use it for breakfast. You actually can use it, believe it or not, in things like a chili. You can use it to make like veggie burgers. You can use oats cookies, meaning like healthier cookies, lots of things. Brown rice, so your healthy grains. White rice is fine, but you should also want things like brown rice. Barley is another great choice, very high in protein and fiber. So if you're looking for a grain that's going to be more filling on a budget and shelf stable, that's another one. Your beans and lentils. So these can be canned or they can be dried depending on, if you want to cook them or not. The dried will stay a very long time, take up less space. But if you're looking for convenience, canned beans are fantastic. Things like whole wheat pasta or pastas. You can do so much with pastas, meaning you can cook them and use them for a variety of things from hot to cold entrees. Canned tuna, so like canned meats are okay, but canned tuna or salmon is fantastic. Canned vegetables, and try to make sure if you're getting those, you want to do them without added salt. Your fruits, if you're looking at canned fruits, try to get them in light syrup or natural juices. If they don't have that available, rinse the syrup off. And last, I'll say things like dried fruits. If you can find raisins or apricots or dates, those things will last a long time.
Wow, that is
A
that
lot.
that's huge. Can you also put oats in if you're making a meatloaf?
Absolutely. So you can use it to replace breadcrumbs. And that's the nice thing is it's really versatile. You can use it for so many things. I also throw in flaxseed, ground flaxseed meal in my meatloaf, oats in there. So, great suggestion. And it's a healthy way to also add some fiber to your meatloaf.
Okay. Well, oh, so also part of this program, I talked about recipes. So let's say um let's say from the food that you've gotten from between the pantry
Yeah.
and the store, what would you consider? And let's start with pasta, because we know just about everyone enjoys pasta, and they also make gluten-free pasta. So,
Yep.
what would be a an example of a gluten-free pasta meal with with all the proper nutrients that you just mentioned?
Yeah. So, the typical, as you mentioned, like a lot of times people do, they like to do, let's say they're doing their pasta and they do it with sauce, right? It's usually typically like sauce and meatballs. And I'll talk about at the end, things like this time of year, we make our own pesto at our own house. And we literally just take a food processor and I take basil that I grow that you can grow on your windowsill, and mix it up with some spices. Sometimes you can add some pine nuts, or I've done it with almonds before. But pesto is a great thing to do with pasta. But now here's where we kind of ramp it up a little bit to even make it more nutritious. Add vegetables to it. So you can do that. So you can take that pasta, gluten-free whole wheat, you can make a casserole with it, meaning you can take a can of tuna. I've taken things like a cream of mushroom, but I try to do the low sodium, and I'll add that in with some Greek yogurt. And then you can do canned vegetables or like a frozen mix of like peas and carrots and corn, and make that as a meal. So now it's a meal that's included some vegetables, some protein. You can add, some fiber. You could add chicken to that or beans to it. But you can also take that pasta, and I love this for lunch, is to do a pasta salad where it's cold. You can add a nice light vinaigrette or a light like Italian dressing. Even put a little bit of feta cheese. You don't have to do that though, but you can put vegetables in there. This time of year, we've got an abundance of fresh vegetables. Add the cucumbers, add the tomatoes, add zucchini, add peppers. And then you can again add some chicken on the side or add beans to that pasta to make, to add that protein part in.
Can you freeze the meal?
So a lot of meals will freeze better than others, but yes, you can freeze. You have to be mindful of, I will say that a gluten-free pasta, because of, even if it's like a brown rice pasta or a quinoa pasta, you'll notice it's not as dense. So it does kind of fall apart sometimes when you're cooking it. A whole wheat pasta, the nice thing about it, it tends to freeze a little bit better because it's a little denser pasta, but you can. The other thing you could do is you could take it. I would make sure that, of course, I just want to remind everybody to be mindful of leftovers. They should be eaten in about 3 days. So if you put that in the fridge, make sure you eat that in 3 days. But I have frozen meatloaf. I have frozen, like if I do a baked ziti or, lasagna, you can freeze a lot of things.
Hmm. Can you just tell me why sometimes, you just said something very important. Leftovers should be eaten within 3 days. And I was speaking with someone recently, and they were saying how sometimes when they eat like a broiled fish, like after day 4, and they just really can't eat it. What's magic about 3 days and leftovers?
So there's a couple things. So one, I will share that leftover food, by the way, should be refrigerated within 2 hours of cooking or when you've removed it, from a heated appliance. Meaning, if I cook something in the oven, you should make sure if you're going to put it in the fridge and it's not going to be eaten right away, you do want to do that within 2 hours. After that, they do say you either have to freeze it or consume it in 3 to 4 days. And honestly, the bottom line is to prevent bacterial growth. So the whole idea, right, of how we have the fridge and the refrigerator, and the freezer, is that that temperature will inhibit the growth of the bacteria. And especially this time of year when it's warm and hot. And if you're in a home that doesn't have, air conditioning and it's hot, you don't want to leave food out on the counter for a long period of time and then have it in and out of the fridge too long. You're really promoting that bacterial overgrowth. And then you can get sick from that. And that's, unfortunately, food poisoning, as they call it, is more common than you think. but you want to be mindful of that. If you don't think you're going to eat it, freeze it.
Okay. That makes and that makes total sense. How about so you just gave an example of a meal. How about a meal with beans? Something that you said canned beans. So you can even make a meal from, so if you could give an example of, let's say, canned beans, let's say using lentils. What's a healthy recipe balanced meal that you could make, that you would create using lentils?
So lentils or canned beans. You'll find lentils. You'll find more. Sometimes they'll be cooked, like pre-cooked, and then they'll be in a vacuum tight, bag. So lentils, I'll tend to use more. I'll mix it with rice. I've actually made a lentil loaf, so almost like a meatloaf, but you use those lentils, and you can actually, that one does call for oatmeal, and you do have to put egg in there, so you're making a meatloaf out of lentils. But beans like kidney beans, garbanzo beans, pinto beans, fava beans, black beans, those are great. You throw them in salads. You can throw them again in with rice. I like smashed chickpeas. So I'll take garbanzo beans. Now, one, you can make hummus. Literally take your garbanzo beans, throw them in a food processor or a blender or a Ninja, whatever you've got. Add a little bit. I add olive oil to it. I might add cumin, salt, pepper. If you want to put a little tahini, there's lots of things. I've done a splash of soy sauce, and I blend that up. That's a great alternative to lunch. But even just smashing the chickpeas, you can take a can of chickpeas, rinse it well, take a fork, smash it, add some Greek yogurt or a little mayonnaise or a little sour cream. And, you can add some herbs or spices to it if you want, but you can actually put that in a pita. You can make a sandwich out of that as well. So they really are versatile. You can use them for a lot of different things.
And it's funny. That was my question. What if you don't have a food processor or whatever? I know that I think I have my grandmother's smasher when I make banana bread. I just use it it's like all these coils.
Yep. Yep.
It's antique. I know it is, but it works.
Yeah, I use one of those all the time, right? For smashing bananas, for smashing. A lot of times you'll even see ones, they kind of almost look like an X or like a T, or not a T, excuse me, like an X, that where you can break up like ground meat if it's in a pan. You could use that as well to mash things or to smash them. Do you mind if I share one other recipe that's really easy?
No, of course.
Because we're getting into like back to school, and you mentioned kids. This is one of a favorite, and I actually just saw this in a magazine recently, but I've been making this for years. It was one of the grocery store had this on the back of their flaxseed meal. So flaxseed meal is just flaxseed that's ground up, right? And you can buy it literally at any store. Very good fiber, very good lignans, omega-3s, all that good stuff. But they're energy balls. So I take a cup of peanut butter, crunchy or smooth. You do half a cup of oats that we were talking about, and the peanut butter, right? Both shelf stable. I do half a cup of flaxseed meal. You do a third of a cup of like honey or maple syrup. And you can throw in raisins. I do throw in some chocolate chips for, the kids, but you roll them into small balls, freeze them for an hour, and then keep them in the fridge. They're great to grab for breakfast. If, you're running out the door, you want something that's healthy, or the kids are looking for a snack. But it's a nice option, and it's using a lot of those shelf stable items.
So speaking of shelf stabilized items, what has the longest shelf life? Are oats longer than beans, longer than pasta? Again, I'm looking in my bag from the food pantry. So what should of all the different foods with a shelf life, what should I focus on using first?
Oh, so well, the beans, so any canned good is going to have an expiration date on it. So that is something you do want to be mindful of. Do you know what I mean? So actually, it depends on what the expiration date is on those beans. Now, with regards to oats and dry goods, you actually they'll last up to 2 years. They also have an expiration date, but I will share with you that with grains, and again, I'm not a chef, so a chef may answer this better, but I was going to say, if they're, you want to make sure that they're stored in an airtight container, just like your flour, right? Flour goes bad as well, and you have to watch that. Sometimes you'll find like those small, you can get almost like little bugs in there. So you have to be mindful. But your oats and your like dried beans, those will last a really long time. So will rice, a very long time. The canned stuff, you just want to be mindful of the expiration date.
Hmm.
Your
Oh,
dried beans will last longer, most likely, but again, it depends on the date. The things you want to use quicker, of course, from a food pantry, those are things that are going to be refrigerated or frozen. Honestly, if you get any fruits and vegetables, those you either want to use immediately or commonly people say to me, well, Kelly, I don't like to buy fresh fruits and vegetables because it goes bad. Of course, my comment is we have to make sure and eat it. But there are things that you can freeze. Like it was blueberry and strawberry season. If you buy those things and you're like, oh, they're going bad, before they go bad, I rinse them, I clean them up, let them dry fully, and then I freeze them so I can use them later, like and maybe throw them in a smoothie or thaw them out and use them for other, recipes.
mm-hmm. Yeah, and I know the other day I had a banana in the refrigerator, and I wasn't sure if I should use it. I mean, it was just like so black. I didn't know if there's any nutritional value. I should have transferred it to the freezer. How long can a banana stay in the refrigerator versus in the freezer?
Oh, so the freezer will be much longer than in the refrigerator because of the temperature being so, what I mean, the temperature is going to drop, it is much lower. The only thing is that in the freezer, you have to remember it is going to start to get a little bit mushier, because there is water in there. So fruits and vegetables have high water content. So anything that has a higher water content, when you freeze it, it may thaw out and be a little more watery or mushy. Do you know what I mean? Or may freeze that way as well. That's why I mentioned if I do anything with berries, I make sure that the water, I let everything dry before I throw it in the freezer. It will last much longer in the freezer than in the fridge. But you want to make sure you peel it first, put it in the freezer. But then again, if it's in the freezer, maybe I save that for banana bread, or I've actually thrown it in like a Ninja or a blender and made almost like an ice cream out of my frozen bananas.
I know we are running out of time, but and I know your time, you wear many roles. You work, your mom, your wife, you're almost done with your PhD, and you do speaking engagements. Do, do you have a website with some of the recipes on here that we've talked about?
Oh, so I will share with you one of the best one is nutrition.gov has a lot of information, meaning your government websites where you even find information, you'll find the website like information for SNAP benefits. Erie County also has some information. I actually apologize. I'd have to find the exact website, but I know that they provide, where those food pantries are. A lot of your food pantries and they will provide recipes as well for the foods that they are that they have available that week. But nutrition.gov has a lot of great information. And if you don't mind, can I just throw something out there? I just want to share with everybody because this time of year we were talking about budget. Look for coupons, use them.
Coupons, yes,
Coupons, buy in season. Look at the
yes.
unit price. Don't look at the total price. You have to look per unit or per ounce, or because again, the prices, all of that stuff's going to be on the tag in the grocery store. And then buy the frozen. But last, I want to remind everybody, if you have SNAP benefits, they give you 2 for $1 at a lot of participating vendors for fruits and vegetables. So what that means is up to $20 a day. I can do this. If I go to a farmer's market or I go somewhere where they accept and they participate in this program, I will get $40 worth of fruits and vegetables for $20 of my SNAP benefits because the government matches dollar for dollar. They call it double up on your food bucks. So I just want to remind everybody of that because a lot of people in SNAP don't know that.
Mm, thank you so much. And I also have to say Massachusetts Avenue food project or
Yeah.
they also give or at least last year they gave recipes, in hand. So you were able to have a recipe. But Kelly, we have like less than a minute left. I want to thank you for being our guest, but I want you to do you have any one last word you want to share with us with our listeners?
no, just, start with small changes, do the best that you can. Nobody eats I don't even eat a perfect diet. It's just, do the best that you can and start with small changes. Like we talked about, adding beans, fruits, vegetables, one thing at a time, and that's okay.
Well, I want to thank you, Kelly Cardamone, Mass MS. She is clinical nutrition and dietitian program manager at General Physicians. Kelly, are you taking new patients?
We are taking, so if not myself, but my team, we have a team that works with women's health, diabetes. We're all diabetes educator. I also have a dietitian that is certified in pediatrics. So she does nutrition counseling for peds. We are all taking new patients.
And cancer? Someone who
So
survived cancer?
we do see for oncology, but there's also another program where we may, depending on if they can be seen, qualified to see one of the dietitians that's part of Kaleida, but she's meaning part of Glenn, but she specializes in oncology. So we kind of collaborate where is needed.
Okay, thank you. And I also want to say, if you have GI problems, again, Kelly and her team, I highly recommend. Well, Kelly, I want to say thank you so much for being our guest this morning on the Great Lakes Health Radio program. And in 2 weeks, listeners, I look forward to sharing another program with you. My name is Francesca Messiah, Manager Workforce Development for Kaleida Health. Thank you so much for listening to our program. See you in 2 weeks. Take care. Bye-bye.